Before I start the presentation, I would like to introduce myself. My name is Nisha Dr. Jiva and my metric number is 10DLS22F1066 from class DLS3B. And my group member name is Sharveta Dr. Murugan and her metric number is 10DLS22F1043. Good morning to Badam Nurbazila and my fellow friends. Today I and my group member would like to present about process and procedure on how to perform cardiopulmonary resuscitation CPR. These are the equipment that we have used for CPR. First one is disposable gloves. Second one is automated external defibrillator. And the last one is CPR face shield. Area is checked and examined. First of all the area is checked and examined, although it is the best to start resuscitation as soon as possible. When the procedure is performed, the person who is performing the resuscitation must ensure that they are safe. This includes looking out for traffic, fires or other potential hazards. Stay calm and don't panic. Responsiveness. Second, the responsiveness is checked by tapping the victim's shoulder. Determine if CPR is needed. The person who appears to be in trouble is asked loudly, "Is okay?" or the person is gently shaken to check if they are responding. Listen, looks and feel for breathing. CPR is only needed if a person is not breathing.
Can I help you? Are you all right? 1, 2, 3, 4, 5, 6, 7, 8.
For the safety precaution, do wear gloves. Do not be exposed to fields from the patients with burn ends. Call 911. Thirdly, someone is instructed to call 911. If two people are present, CPR can be immediately performed by one while the others call 911. However, if only one person is present before performing CPR, that person should call 911 if they have immediate access to a phone or the CPR is performed for about 1 to 2 minutes and then call 911. Pulse and the respiratory. Then the pulse and respiratory are checked. Pulse and breathing are checked to determine if CPR is needed. It is important to check both pulse and breathing before starting CPR, as CPR should only be given if the person is not breathing. The person is placed supine. After that, on a flat or a firm surface, the person is placed supine. From example, on the floor. Before starting CPR, it is important that the person is lying on a flat, firm surface, as this provides a stable base for chest compression. That's all from me, and I would like to pass to Sharveta to continue the presentation.
Then, chest compression is begun. This should be only done if the person is unconscious and not breathing or moving normally. For adult victims, the heel of their dominant and hand is placed between of the person performing CPR and slightly below the victim's nipple, and the other hand on top of this hand is placed. The shoulders are positioned directly above the hand and the arms are kept straight. The chest is pressed down about 2 inches with your body weight, and chest compression is continued at a rate of 100 compressions per minute. Meanwhile, the safety precaution for this step is don't bend your arms and keep them as straight as possible. After that, the airways are opened with the head tilt chin lift technique by placing on hand on the chin. The forehead and the head is tilted gently to the back. This ensures that the airways are opened and air can properly enter the lungs. For adult mouth-to-mouth ventilation, the nostrils are pinched and 2 breaths are given into the mouth. So the step 8 is CPR cycle is repeated. The CPR cycle of 30 chest compression followed by 2 ventilations is repeated until the emergency physician arrives to provide advanced life support or until consciousness and moves are regained by the victim. So the safety precaution for this step is avoid bouncing. Your hands need to stay in contact with the casualty's chest during compression. As soon as an automated external defibrillator, which is also known as AED, is available, it is used immediately. Instructions of how to use AED can be received by the assistants from a 911 operator for the persons who are not trained to use it.
Firstly, turn the defibrillator on.
Apply pads to patient's bare chest.
Then place the pads in these positions, here and here.
Plug in pads connector next to flashing light.
Then connect the pads to the defibrillator.
Analyzing heart rhythm. Do not touch the patient.
Then you need to follow the instructions of the defibrillator as it analyzes the rhythm and will tell you whether a shock is advised or not.
Shock advised. Charging.
If a shock is advised, wait until the defibrillator has finished charging
Stay clear of patient. Deliver shock now.
and then press the flashing button.
Shock delivered. If needed, begin CPR.
After you've delivered the shock, you'll need to continue CPR.
So the safety precaution during this step is, please read or listen instructions carefully on how to perform AED. As for this step then, informations are explained to medical professionals, such as how the victims was found and how long CPR was performed are explained to the relevant medical professionals, as well as any other information that may be relevant to the treatment. Learn CPR, save a life. And that's all from us. Thank you for your attention.